them for us. The federal government doesn't specialize rules for the state of Colorado. They do it for all of us, and we have to implement those how we see they fit into our Medicaid system here in the state. And that's part of what the final settings rule changes are and why we're doing case management redesign, so we can be in compliance with the federal statutes. The other really powerful entity is you all. You as parents are a really strong force. A, you know your loved ones better than any of us will. B, you're advocating and fighting for them. So as this change happens, some of that policing of, is everything going okay? Is everything still the same? Some of that's going to fall onto you, unfortunately. But it's not like it hasn't happened before. Unfortunately, our system, some of that already falls on you. But it's really just watching and paying attention to how they're moving through this, with the idea of the state, I can tell you, is doing a huge lift. There are calls on the regular basis, which I can send the autism community store for you all to kind of, if you want to do, they're open forums. So one of them, the myths of what's coming down the pipe with case management redesign is a great one. They run on a regular basis with Tiffany over there at the state, but they're doing a lot of planning to make sure they don't miss things. The state moves very slow with things. That's why this is a 4-year process. Case management redesign has been going on for a little more than 2 years now, with some planning, with some outside entities, and the group they have, the agency they have working with them, from the Arapahoe, Douglas, and Elbert County standpoint, is really doing a good job of listening to the stakeholder, which is you all and us, concerns. So change is going to be hard. Not all of you will be able to developmental pathways. It's the CCB for the Arapahoe, Douglas, and Elbert County. They have to win the bid. If they don't, it might be somebody else. So, and that'll be a major change. I mean, they serve more people with disabilities in their CCB than the others. Rocky Mountain's not far behind. TRE and down in Pueblo or Colorado Springs. I mean, so they're tough changes coming. But again, the system is hopefully planning for that. I mean, there's a question here about, is the state planned to help with like that transition and training of new case managers? Yeah, the state, once the RFPs are the request for proposal, so the state's going to put out, and everyone puts their name in the hat, and the state picks who they're going to be for the certain areas of the state, kind of cut up by county. It's not going to be like tomorrow we're going to make that change. The change won't go into effect for until, and I believe it's 2024 when it officially will change. So there's time for the single entry point, the person that wins the bid, to hire, up-train, and train new staff on the new waivers they're going to take over and support, along with the waivers they're already working on, be it if they're on our side of the disability side of the coin, or if they're on the other waivers side of the coin. So there will be time. It's not going to just be, oh, we have to do this like tomorrow. Here's your new case manager. Have fun. It's going to be a process from when that bid is, the bids are taken, the contract is awarded, and then the actual support starts. So there's a question here around, will there be steps in place for smoother transition from school age to adult wraparound services? I assume adult wraparound services are like the adult waivers, so SLS, DD waiver. The idea is case managers and community center boards should be having those transition meetings, those conversations before we get there, and that you should be getting that support to kind of coming into the adult system. If you're nervous about that, if you're kind of in that world now, you're young one with a disability is 14, 15, 16, 8 to about 18. There's some videos of the Arapahoe, Douglas, and Elbert County's website that goes called Step Up into Life After High School on our YouTube channel. That kind of explains the adult system currently. Some of those will change because the system is changing a little bit. So, but for the most part, I mean, the hope with case management redesign, to be in federal compliance. That's one of the big deals, because we can't make major changes to waivers until the federal government says, yep, you're following our rules. We live in their house with the United States, and they kind of make that rule. B, it is to really help streamline support. So we're not having to have families call 20 different places to figure out what waiver they're supposed to be on, who's the best resource, is your loved one better served in CDOS on the EBD or CDOS and SLS? When that's all housed under one entity, they can do that right there with you. And instead of it being, well, let's call this agency and run some numbers and figure out which is better and which is worse. So the idea is those services, or that transition from, hey, we're 18 to now we're an adult, into the adult system, they should be working towards that now. If your agent CCB is not, there are ways you can make a request to the state to let them know. You can always go to the management or the directors of a CCB, that they're there. It's part of their complaint process, and explain to them like your concerns and what you're looking for. But the hope is that with this all being under one house, that it will help smooth out that issue. Tyler, I'll take your question just 1 second for me. There's also a question here: will there be an advocate or individuals with disabilities or parents be included in the RFP eval committee? That's above my pay grade. I don't know. I know the state has been doing a lot of feedback sessions. Some have gone really great for stakeholders, some not so much. And just kind of, and it's not saying that you as the stakeholders aren't making them. It's sometimes there's a lot going on and one person takes over the meeting and it's not productive. And other times, many families and stakeholders get to put their words out there and the state has listened. So I don't know if you'll be included in the actual RFP eval committee, but I do know there are members within, like there's members of the ARCs that are on case management redesign. Members of the ARCs have been on the new assessment tools, which will be something like replacing the SIS and replacing the 100.2 assessment if you've done those. So like, and there have been families and what we call stakeholders, or people utilizing Medicaid on those kind of, I don't want to say pilot groups, but like test groups of designing it, looking at what the flaws might be, and then coming back around to like try it again. So like the SIS is an example, this support intensity scale. The new assessment tool was supposed to be rolled out here this year. It's not quite ready for prime time yet. So we pushed it back 2 years. And talking with the ARC, that one of the ARC chapters that their staff is on, and one of our staff too are on that assessment tool review process, are saying the state's actually, the pushback is good because it wasn't ready. There's still some tweaks that need to be made, and there's a little more testing that needs to be done. And the state's really trying to do those test pilot systems here now and moving forward a little bit to really try and help there not be errors where it's not working, like the button's not letting this case manager submit the units so your loved one can continue to get programming they need. Tyler, did you want to unmute yourself?
Yeah, thank you. My question is, I'm going to throw it out to the room. And then maybe people can respond in the chat there with their responses. I'm living in the Denver area, and I myself, I'm on the spectrum, and I'm going to school at MSU. Eventually, I want to work with this community, especially in rural areas. And so basically, my question is, like I said, I'm going to throw this out to anyone who, not only you, Luke, but to anyone else who might have similar answer to this question. I was wondering if anyone knew of any sources that might be able to help adults like with like different needs and such related things, or if there's anybody that represents particular different resources. I see the Autism Community Store and some other places that may serve adults? Yeah, feel free to answer anybody.
Tyler, I can tell you that at the store, we do have a support group for adults on the spectrum, and they share a lot of resources, and we'd be happy. I can put some information about that into the chat for you.
Thank you, Sean. Yeah, I'm also part of a autism group with my school, the Isaac program. It basically serves college students like myself.
Well, okay. Well, Tyler, I mean, I can share my contact information if you wanted to chat more about some ideas I might have or other entities I know that might be a good connection for you to start seeing what you can and what might be a good fit for you.
Thank you, Luke. That would be greatly appreciated.
Yeah, I'll throw my information here in the chat in a minute. April, you wrote in here, will this affect self-run case management for the adult EBD waiver? Are you talking about CDOS or IHSS? I don't know where you are, April.
No, I was thinking more about the adult, elderly, blind, disabled waiver, where you are when you're case managing your own services, like trying to find your own respite, etc. Is that going to be affected?
So the delivery models within each waiver, and so that's what you're asking about. So that's a delivery model within the waiver. So like family caregiver might be one you all know very well. That's a delivery model within the SLS waiver, and a different delivery model within the DD waiver, and so forth and so on. The delivery models within the waivers, case management redesign is not changing that. Case management redesign is not changing what day program looks like, what support employment looks like, what residential looks like. It's changing the overall of who's managing the actual Medicaid dollars to be put into services back and forth. The final settings rule might come when that comes into play here in a few years. Will change a few things within the waivers just because we need to make sure we're fitting some more federal guidelines. But that's one that will be have to be a whole nother conversation because that gets into even more weeds and concerns because that is another change coming down the pipe is that final settings rule. But it's a good change. I mean, it's still definitely going to help us open a lot more doors. So if you're using family caregiver, self-run case management under the EBD waiver, CDOS, IHSS, and any of the waivers that those are available in, those services, the services itself won't change. Essentially, again, it's that case management agency and how we get people into services or keep your loved ones in services will change. Again, some of the assessments, what that looks like, and things like that. Any updates on the residential treatment waiver? Was that what I believe that was also you. I'm struggling.
It was.
Okay.
It was just a question as to whether or not there were any proposed changes to that particular waiver to reduce the wait list.
Yeah, I mean, there's nothing that I know of yet. I mean, unfortunately, that's one of those like there's no wait list to get in EBD, but there's a wait list to get some of that support within that waiver. I haven't heard any changes yet. But again, the state is not making major changes to a lot of things because they're kind of dealing with a major change of case management redesign and the final settings rule. Is this transition or private case management agencies going away? Are there timeline requirements for CCB start services? 8 months to get services started. So let me answer the second part of that question. Are there timelines? There are timelines within the enrollment process for the waivers. They're written into waiver rule of how long an agency should be having, not necessarily how long an enrollment should take, but certain parts of that enrollment. 8 months is definitely a long time to get services started. Not knowing the specifics, my guess could be that they're struggling to get the determination done. That's one that typically holds up the process, or that you're struggling to find a provider. I mean, right now with provider shortages, you can't start a waiver until we actually get providers in there. And if you're really struggling with El Paso, and you just feel like they're not, essentially it's TRE, the resource exchange. If you're really struggling, you just feel like they're not listening, and that 8 months is because they're not following through appropriately. You can definitely file a complaint. That's part of the rights you have. But B, you can also, you reach out to us here at the ARC. There's the ARC of Pikes Peak, and Will and them down there to see if they're hearing that and what their connections are with the community center boards or case management agencies. I can tell you up here in Douglas, Arapahoe, and Elbert, if a family came to me and said it's been 8 months and we're still waiting for services, that's where I'm calling the enrollment associate director with developmental pathways and having that conversation of what's going on. Here's my release of information, so you can talk to me. Let's go through what this person's case is and what the positive and negatives are within that case. So the first part of that question is this transition. Are private case management agencies going away? Unfortunately, yes. If you're smaller private case management agencies, unless they win the bid, unless they want to go out and try and be the single entry point for the area that they serve, the model will be that you have to be the single entry point. That services are all going to be based out of that single entry point of contact. So depending on where you live, again, that's going to be, our hope is that a lot of community center boards will go for the bid and win it, because again, they do have a pretty decent model, and we all know them. We have relationships. If it's another Medicaid entity, that's fine too. We'll learn and adapt to them in the different areas. What's the time frame for case management redesign? Currently, it's supposed to run to 2024. Is when everything's supposed to be set in place. We're supposed to be going. There are different stages along the way. So again, we're rolling out different assessment tools, and they're doing some pilot programs that here either now or within the next handful of months to really get that going. I understand a lot of families, don't necessarily like your CCB. The idea of changing, what you're telling me is I'm going to change your bank account idea. The models are what they are. I can't tell you who's going to win the bids. I know in some of the areas of the state, I do know some of the CCBs aren't great. And that they are either a little stuck in older ways, or they're not as maybe progressive as some of the other areas are. But I can't tell you that, you're kind of, that saying you're the person you're better with that than the one you don't. If a different entity came in to be that community center board or the case management single entry point up here in Arapahoe, Douglas, and Elbert County, it'd be a lot of work for us as a chapter of the ARC. There'd be a lot of work for the Autism Community Store, because we'd have to relearn a lot of those relationships that sometimes get the work done behind the scenes, because of that relationship building. I'm not saying CCBs do a great job by any means. They definitely have room to grow. I was just at a conference for a week in Pueblo with 2 different CCBs in the state that were there, both really focused on growing and learning to be better at person-centeredness, better at listening to families' concerns and stakeholder concerns. So there are good ones out there. There are the ones that are willing to make the effort. And if your CCB is just not holding water, there's ways we can help you, either through us or other entities via advocacy, or connect you with how you can explain that to the state, or if you want to make sure you want your concerns heard. So, the concern that Heather has here is that El Paso County is going to be that TRE might be essentially the single entry point. They currently don't do well with their current caseloads. I can't speak to that. I don't work with TRE too often. It's more of a glancing blow. But again, those RFPs have not gone out. The bids haven't been made, and the contracts haven't been given. So I can't tell you who down in the Springs might be willing to pick up that load. You currently have a single entry point down there that more than likely might not want to just give it up. So it might be TRE loses the bid and the other entity or whoever else bids for it wins it. So we're in a holding pattern, unfortunately. There's not a whole lot I'm going to be able to make you all feel better about who is going to be your case management agency in the next 2 years. Like right now, it's who it is. If it's CRE, it's CRE, and if there's issues there, again, there's ways we can address those and talk to that. But if it's 2 years from now, it might be again Luke Wieland agency for all we know, and that's going to be a different set of challenges and a different set of maybe positives. What they pay case managers or what they look at, what caseload size can be. It's all part of that process. So.
Luke, we've had a couple of questions from people asking if you know what the criteria are that will be used to determine who wins the bid on the RFP.
No, the state's not. I don't know that. If the state has made that public, I haven't heard of it yet. So, the idea of it being what criteria, you're gonna have to show. I can tell you when Rocky Mountain won the bid to be the single entry point for the non-DD waivers, the RFP, they had to show that they were capable of handling the number of people that were going to come into their catchment. They had to show not just yep, we can do it, hand up, we can. It was actual data, actual programming. They had to give some actual numbers to full-time employees, so FTEs they were going to hire, having to replace. They we'll look into that. So it looks like Michelle answered they can submit for the RFP for that private case management. Thanks, Michelle. They can essentially subcontract, which we'll see some agencies might do that, but criteria wise, the state's not just blindly going to give it to anybody. For some of the smaller rural areas, the San Juan Mountains, the Montrose, Telluride valleys, they might only have one or two people submit the bid, so there might only be one person going for it. Because some of those other waivers, the waivers that aren't the disability waivers, are currently being managed by the county. So, and some counties like doing it and are going to make bids. There are like 2 here in the metro area that the county is going to make a bid to be the single entry point. But some of those rural areas, they don't like being the single entry point for the other waivers, and they want to try and push that to some of the other entities. We have a lot of questions here. I'll try my best to answer as much as I can, but how will the state monitor all these new agencies? Actually, the idea is, Peters, the idea is that they're reducing the number of agencies they have to monitor. With this current model, there's 20 CCBs within the state plus single entry points that are managing the different waivers. So this new model is supposed to bring down that number to be a more manageable system, that now the states will actually be able to do some of that. Not saying they're not monitoring on their own, but again, it's a give and take. But the hope is that less issues in the machine will help the machine run better. So who wins the bid? Again, the state does have a list of some of those requirements on their website of what those bids will look like. But again, not necessarily the single, exactly what they want. It's more of a very wide range, like any other job kind of RFP, like we do for your loved ones. When we send out an RFP, we want a pretty wide range, so they can kind of look at that. it sounds like there's a lot of issues with TRE. Again, if you're having those issues, there's ways to voice those concerns at the state level. TRE has a complaint process. They have to file those complaints with the state every month. I know some of the people at the state that actually review those. So if there's ways you're really concerned with your current CCB model, let us know at the ARC so we can definitely connect you with how that looks. So the RFPs will go out in January of 2023, and then the transition will start between June, essentially one calendar fiscal year for the state. So there will be half the case management agencies to monitor. So yeah, that's answered. We got that one answered. Will those on the waivers already just roll over to the new management, or will they have to they should just roll over. There's no one that needs to like reapply, look for, what you're like redo anything until your annual normal service plan, your annual Medicaid paperwork, all that stuff will stay the same. You shouldn't have to essentially like reapply to make sure you're still on the waiver. If you're in the DD waiver right now, you'll be in the DD waiver come the 2024, 2025. It'll just be, again, kind of who's controlling the actual access point to Medicaid within your community. Now, not to say that you won't be doing some new assessments, like again, this, are they replacing the SIS assessment or support intensity scale? Yes, they will be replacing that with a more person-centered assessment. From what I've heard, it looks really good. Again, there's some tweaking they need to do. So it's not ready yet. Again, it was actually supposed to be rolled out this year, but they're pushing it back a little bit. So there's another one for TRE. You will not need to reapply. So that was answered there in the chat too. With a large systematic changes like this, there's usually a time frame for people to report issues of going through. I'm not sure. Oh yeah, there's a weekly Zoom call-ins. Yes, so the Office of Community Living and there's a whole case management redesign page actually has meetings that are open to different parts of the stakeholder groups. So there's some that are built for you as families and love and caregivers. There's some more built for the case management agencies and case managers themselves to voice their concerns, because case managers, to tell you the truth, are just as nervous as you are. Because if Development Pathways wins the bid, some of those case managers have to learn 7 other waivers. That's a big job change for them. Some of them are nervous that if they don't win the bid, what happens? I mean, that's their job, right? So case managers are nervous too. So they're giving that voice. And I was able to sit on one of those calls as a listener and listen to case managers talk about what they're nervous about and making sure that the system they operate works so that you as families aren't angry because the button that says submit isn't there. So they're voicing their concerns too. So if you're interested in looking at that calendar, the Office of Community Living has a great calendar that's up there that actually gives out the dates of all their meetings. You can get on to John Barry has a memo list that he sends out, like an email memo once a week that highlights handfuls of different meetings and different time frames going on. One just came out. I don't know if it was today or yesterday. There it is, John Barry, Office of Community Living. So they have meetings around support employment, stakeholder engagement meeting coming up, Community First Choice Council, the electronic verification listen session, talking about how that's working or struggles with that. Transitioning people out of more of like institutional settings or and then there's the Department of Justice transition stakeholder meeting coming up. Those are the ones highlighted here in his memo that came out yesterday. And those are all for pretty much that first week of October. So if anyone wants to get on that, there's a whole way to subscribe to, it's a constant contact like newsletter that comes out. And a lot of us within the chapters use that too. So let's see, but they are changing how often you are reevaluated to every year, correct? I'm not sure if you mean, yes, I mean, you are reevaluated, not for the SIS, if that's what you're asking. The support intensity scale is, you don't have to redo every year. The new assessment tool for what that will replace the SIS should not be a yearly tool. There will be the normal yearly assessment we go through, which is essentially similar, like we have currently the 100.2 and service plan you go through, plus your Medicaid paperwork or Social Security paperwork you submit to maintain that Social Security and Medicaid. They really pushed for that to be, done on, a really timely issue for you, a timeline for you guys. But so there are some reevaluations done every year, but not necessarily that whole long like SIS assessment or what will replace that with the new assessment tool. Okay, this is a long one. Oh, it's more of a statement. Okay, yeah. So, yeah, that the idea of all the waivers under one place, all 11 of them are the idea that we have essentially many different hands in the cookie jar, kind of help to, depending on what service your level one, mental health, disability, elderly, whatever that might be. So having it all be kind of a little more centralized should help, sort that out. That's thinking about the autism community store. There's the timelines up there for case management redesign. How many people are with care providers? If yes, post a quick note in what county you're in. Yeah, I mean, we definitely know a ton of people are struggling with care providers. Direct care staff are hard to come by. I mean, there's ARPA money. There's a ton of ARPA money from the feds coming into the state that has been earmarked for things like respite expansion. There's money there. It's just, again, we need a workforce. And COVID really decimated that workforce, but we spent a lot of time building up. We've kind of already answered the question of, will awarded entities be able to subcontract? That's going to be up to that single entry point. But there's some, thanks for the voice that Arcs of Pikes Peak does a good job. They do will and them down there, like the rest of us around the state. But again, we cover the entire state, the ARCs do. So if you need help, we can definitely help. Some more support groups here. What criteria? Again, we got that. Some more around direct care staff. Again, the best way to get involved, if you really want to be part of that stakeholder group, either you should all have my contact information. If not, I'll make sure it gets in the chat before we end it here, and I can send out. I don't have multitasking with all of you in questions of pulling up how to sign up for that office community living calendar or the updates from the state on upcoming meetings. There's stakeholder group within the HAGPUF around your stakeholder or your individual using Medicaid. We want to hear from you. So they do that on a regular basis. I mean, one of the biggest things I can say is I can tell you all not to worry, but that's not going to change you worrying one way or the other. Understand this isn't willy-nilly. They're not doing it just because they have to do something. This is a very big change, and it's needed. We definitely need conflict-free case management so that we have, kind of that division between provider and case management. We need, that redesign component of, getting less entities that we have to report to, trying to make it a little more less complex than it already is. And so once we make this change, it brings us back into that federal compliance. And then a lot of those other things we want to do, we want to make changes towards, and those like 1,000 feet goals we have, of how to transform the system are built out of this change. So happening now, or it was, we've been talking about it for a decade. I mean, my dad talked about it when he's been retired for 15 years. Case management redesign has been something that's been kind of kicked down the road over and over, and we're finally got a hold of it and can set it in place. So the state's not just going, well, this is what we want to do, and you guys are all going to have to deal with it. But those concerns, you have an amazing support group here. So having these groups continue to meet and talk, and if we want to have us back again, if you want us to bring on a few, look at, people from HIGPUF that would be willing to talk to a group, or whatever that might be, that'd be great. I mean, we can try and help you all out with, again, trying our best to relieve some of that fear, change, but there's always going to be change. Yep, and there's Nicolette put in the stakeholder group there for me.
Do you mind if I'll make a little plug for the stakeholder group too?
Yeah.
Real fast. So I would definitely, that link that I put in for the stakeholder engagement meetings, there's going to be a lot more for the people that had questions about. There's going to be more regarding case management redesign. I'm Nicolette Anderson Cordova. I am with HIGPUF. I am with the Autism Community Store. I'm in an interesting part. I help co-facilitate a parent support group with the Autism Community Store, and do whatever parent navigation I can always help with. And within this last year, I am now a member of HIGPUF with the Department of Healthcare Policy and Finance, as the case management redesign community liaison. So I'm a waiver mom, I'm a parent, I'm somebody who heard about case management redesign in a negative way and started looking it up and trying to see what it was about. And then through all of my research found that HIGPUF needed somebody, and I needed to start working again because it had been a while since I'd worked full-time taking care of my son. So we are going to be having some more stakeholder engagement. We're having a lot around rule processes that are changing because of it. And so all of that will come out soon. We send out a lot of memos. If you look at the case management redesign website, you'll see a lot of the different policy changes under the memo section. You'll also see a lot of the meetings and stakeholder engagement that we've already had that are there in the recordings. In November, we hope to have another big public meeting about case management redesign. So if you follow that that calendar and you follow the I can't think of the word for whatever reason.
Yeah.
If you can go in there and follow that, then you'll see the next time that we do have that, and we'll have a big informational meeting.
And those recordings are great.
Yes. Yeah. So we have too, like, lots of past recordings too on the website, lots of questions and answers, and lots of things that we just try to keep people updated and informed to all of the new things that we're able to put out there all through that case management redesign website.
So remember the services you're getting, and Nicolette, thank you so much for being on and helping, guide through some of this swampiness. I mean, it's tough. There's a lot of moving parts, and we're not all well versed in all of it. So, but through this, your son or daughter's services won't change. They will continue to be in the waivers from CES to the DD waiver, SLS in between, EBD, whatever that looks like. If there's a rule change, like they're going to take away, I don't know, astronaut school. I don't want to freak you out by saying an actual service. If they're going to take that away, that would be a rule change within the waiver itself, not related to case management redesign. Case management redesign is bringing the state of Colorado under a better focus so the state can actually do some better monitoring, so that all the entities in the state that are providing case management services for all the waivers are talking apples to apples. B, the state can actually have some teeth to go into those entities and say, you're supposed to be doing this way. Unfortunately, some parts of the state read waivers one way, and other parts of the state read waivers the other way. The biggest difference is the metro area I-25 corridor looks at waivers a certain way, and the western slope can see them a little differently. So then you have families that are friends that say, well, my CCB let us buy this, or lets us do this. Well, ours doesn't. The hope with case management redesign is that those systems will be a little more evened out. Because again, they're not reviewing the single entry point, private case management, and CCBs to make sure they're all speaking the same language. They're going to one model for all of them to have to follow.
Right. I think we have like 43 case management agencies currently, all serving different types of waivers, and cutting that down to 20 per your area. That's what my hope is also better quality. From being a parent, having, the more I looked into it, the more I thought this is something that I want to be a part of, because I want better quality with our case management agencies and all the folks that have all these concerns that they've raised about it. I mean, I think we've all been there, and I think that we need better oversight, and I think we need better training, and I think we need more accountability. And I really believe that that's what this is going to help us get to.
And Nicola, that's a great point. One of the biggest components of case management redesign is better coordinated training for case management. Not every CCB does a great job of training their case managers. Some of you have made that apparent tonight, and that is your right to make sure that your loved ones are taken care of the way you feel they should be. And so part of case management redesign is really also focused on putting in training practices that are uniform, that the case management, the single entry points will all be kind of running from the same playbook in terms of what quality case management looks like. One of the recommendations from the chat was if HICPUF could hold stakeholder groups at night. So I'll throw that to you those of you on here from HICPUF, if that's something you guys can all facilitate. Yes, we do understand that not everything happens between 9 and 5. So especially when you live in the world of disability, but also know that your voice matters. So those stakeholder groups, they're listening. The ARCs are here to listen. Obviously, Autism Community Store is here to listen. And if you're having concerns, if you're really anxious about it, reach out. Let us know at the ARC. We can help figure out what we can and help you all troubleshoot areas. Again, pay attention as what's going on. Become part of those stakeholder groups, because again, your voice does matter, especially if you're in some of those more rural areas of the state. Not to say Denver and Arapahoe and Douglas counties don't matter, but there's a lot of us, and we do tend to talk a lot. So hearing from like where I was born in Montrose and Rifle and the smaller parts of the state of what your concerns are great too. But also that idea of don't sit idly by if you think something's not right. Say something. And also the last little bit I can leave with, I know we're right at 7 o'clock, but is don't feed into the myths that there's a lot of moving parts. And so if someone says, well, they're going to take away the Batmobile and you're never going to be able to have that again, that's not necessarily true. Remember who you're hearing that from, and if you're really struggling, reach out to the entities that you know that should have the answers, and that should be the ARCs, the community center boards, the state itself. That right now we're changing how the state organizes all the players in getting your son or daughter in and out of service and maintaining those services. The next step will be improving the waivers and adding more beef to them and getting more supports in there. And again, case management redesign has to happen before we can start really making some rabble rousing at the state level and with the legislation about what rules and changes we want to be made to Medicaid. I know that's my time. I want to thank you all for going through this wild roller coaster. It's a lot. So Shannon, if you wanted to, have us do this again, or see if another chapter of one of the arcs wants to come in and help do it again, we can coordinate that. But the idea is we're here to help support. The arcs are free. If you don't know who we are, we work for birth to death with people with intellectual and developmental disabilities for free. If you shop and donate at ARC thrift stores, that's our funding source. So thank you for paying my salary. But the idea is, doesn't matter where you live. If you don't know what chapter you're supposed to be with, give me a call or email. I can get you to the right chapter. If you just need to vent to someone, I can definitely do that. I might mow the yard while you vent, but it's a push mower, so it doesn't make a lot of noise. But the idea of we're here to listen and help, and breathe. The change happens. We're not making major changes to the day-to-day life for your loved ones. It's really who's going to be kind of making sure all the paperwork and red tape is taken care of for them. I'll pass it back over to whoever.
Well, thank you so much, Luke. We really appreciate you being here and answering these questions. There's obviously a lot of them and a lot of anxiety around change. I think we've all experienced kind of a falling through the cracks during times of transition, and the stress of that entails. So it's wonderful to hear that if my takeaway from it is that the intentions are to improve case management and that we don't really need to be concerned about things changing, and that we can be vigilant and continue to and participate in this process as it's unfolding. So,
Yeah, that's exactly like that case, and be vigilant. That's a great word. And raise your concerns. If you have a concern, every PASA has to have it's not a concern line, but it's a complaint system that they record, and they send those to the state. Every CCB has that same complaint system. It's your right to complain. If there's something you really feel, I saw another chat about just again how they aren't getting the supports they need. You can make a formal complaint to the CCB, and they file it, and they actually submit that to the state. And there are times where when I worked at DP, those complaints come down to direct changes in how those case managers work every day. If you need help navigating that, that's what the ARCs are here for. So again, thank you for having me. But yeah, being vigilant and knowing that we're going to get through this, even if there's some bumps in the road. There's a lot of people in the system that are here for the right reason. As they say, you don't go into social work to make money. It's a passion, and trust me, I tell people a lot that between the state, I either worked for a lot of people up there, they were my boss, I was their boss, or they worked for my father. So the people that at the state are trying their best. They're not always great, and there's definitely times that we want to yell and scream at them too. We're not lovey-dovey with everyone there, but we definitely are here to work together as a team to try and fix the issues we're running into. And I'll be done. I could go on for another hour if you guys wanted, but I'll let you all go back to your lives for the night.
Well, thank you, Luke. And it sounds like we should schedule something again, as this moves along, and keep bringing this kind of important information to people. So thank you so much for that. And for Nicolette and Michelle, all the others who chimed in and answered questions on the chat. Takes a village. Appreciate you all.
Have a great night, everyone.
Thank you.
Thank you.
Thank you.
Shannon, just reach out, let me know, we can chat, and then also maybe tomorrow we can debrief a little bit too.
Sounds good.
Okay. Bye.
I'll be reaching out.
Yeah, Tyler, let me know.
Thank you.